Hi, my name is Dr. Neeraj Agarwal, and I'm going to talk about the results of the PROFOUND trial, which was presented in the ESMO 2020 presidential session. So for your recollection, PROFOUND trial is the first ever conducted randomized phase 3 trial in prostate cancer, which was positive and where patients were selected based on biomarkers. In this case, the biomarkers were defects or mutations inside the DNA repair genes inside the tumor. So this was a randomized trial, and let's look at the design of the trial first. So in this trial, there were two cohorts. Cohort A had patients who had BRCA1, BRCA2, and ATM mutations. Cohort B had mutations in 12 other non-traditional genes or non-canonical genes. There were 245 patients in cohort A, and there were close to 145 patients in cohort B. So the primary endpoint was radiographic progression-free survival in cohort A, but there were several other secondary endpoints, which included radiographic progression-free survival in all patients and overall survival in cohort A and all patients. So in this ESMO, what we saw was very remarkable. Overall survival was improved in patients in cohort A. Hazard ratio for overall survival improvement was 0.69, favoring olaparib over enzalutamide or abiraterone. Please note that 67% patients had crossed over from the control arm to the olaparib arm during the conduct of the trial. So if you adjust for the crossover of the patients, we saw even more remarkable improvement in overall survival, with the hazard ratio going down further from 0.69 to 0.42, favoring olaparib. The overall survival in all patients, including cohort A and cohort B, were also improved. So this is really a remarkable news for our patients, and very happy that we are beginning to see these trials happening in prostate cancer.